This video will demonstrate the removal of tooth number 3 with a simultaneous immediate placement of an implant, as well as an implant placed posterior in the area of tooth number 2. As you can see from this slide, we have approximately 7 millimeters in height for both implants before we get to the sinus. The first thing we have to accomplish is to remove the tooth in an atraumatic fashion. The tooth is being sectioned with a high-speed long 557. It is sectioned in a mesial distal fashion, separating the palatal roots from the buccal roots. At this point, a straight elevator as well as a periotome is used to mobilize the tooth fragments. A number 65 bicuspid forceps is used to loosen the palatal root and remove it from its socket. The two buccal roots were also split, this time in a buccal palatal direction, and then a periotome was used to mobilize. First the mesial buccal root, and then the distal buccal root. Again, we used the number 65 forceps with a long beak to grab onto the mesial buccal root and atraumatically remove it from the socket. The same procedure is followed with a distal buccal root. Sectioning a tooth in this fashion allows to keep maximum bone volume, which will then allow immediate placement of an implant. The site is now being prepared through the interseptal bone for receipt of a 7mm by 5mm Megagen Rescue implant. Due to disease, the quality of the palatal bone was lacking. So here you see the implant being placed between the interseptal wall and the buccal wall. A torque of around 25 Newton centimeters was achieved. Bone graft was used to backfill the palatal root and any other deficiencies around the implant placement. Now we proceed to place an any-ridge implant in the area of tooth number 2. Standard osteotomy protocol is followed, and depending on the quality of the bone, the actual osteotomy width can be controlled. Here we are placing the any-ridge implant, and again we will be seating it into place with a torque wrench and achieving a final torque of around 50 Newton centimeters. Because of bone grafting and immediate extraction, both implants will be covered with a cover screw as opposed to a healing abutment.